For men over 60, the so-called G-spot, which is actually the prostate, can quietly become the reason you're waking up 3 or 4 times a night, experiencing a weak urinary stream, feeling as though your bladder never fully empties, and noticing your confidence begin to slip. You might think these changes are just a normal part of aging, but they don't have to be. As a urologist and pelvic surgeon who has helped thousands of men navigate these often overlooked changes, I want to shed light on what's really happening. Today, I'll explain what the prostate is, why doctors once used prostate massage as a legitimate treatment, and how, when done safely and properly, it may help relieve pressure, reduce discomfort, and even restore aspects of your well-being you thought were lost. This isn't about trends or taboos. It's about reclaiming control over your body, starting with a part you may have never fully understood. So let's begin with the most important question. What is the prostate, and why does it play such a powerful role in how you age? Imagine your bladder as a tank, with the urethra, the tube carrying urine out, as the pipe. Wrapped snugly around this pipe is your prostate, a walnut-sized ring of tissue quietly doing its job since puberty. In younger men, the prostate produces fluid to nourish sperm. But as you age, particularly after 50, it often starts to grow slowly, without obvious symptoms, eventually squeezing your urethra and making urination increasingly difficult. At first, the symptoms are subtle, standing longer at the toilet, noticing a weaker stream, and feeling your bladder isn't fully empty. Eventually, you might wake up multiple times each night, interrupting your sleep and diminishing your energy, focus, and confidence. This common condition, known as BPH, benign prostatic hyperplasia, isn't cancer, but it can feel like you're trapped in your own body. About 80% of men over 70 experience some degree of BPH. While it's natural, you don't have to simply endure it. Traditional treatments include medication or surgery, but there's also a third option often overlooked: gentle, targeted prostate massage. Surprisingly, prostate massage was standard medical practice in the early 1900s, before antibiotics and advanced surgeries became common. Doctors used this method routinely, believing it relieved pressure, cleared blockages, and improved circulation. Men often left the clinic feeling considerable relief. Although this method fell out of favor in the mid-20th century when antibiotics and surgical procedures became widespread, recent evidence suggests it still holds significant benefits. Particularly for chronic low-grade symptoms many older men experience, gentle prostate massage can offer noticeable relief. If you're interested in trying prostate massage safely at home, here are some straightforward steps to follow. Step 1. Prepare your body and environment. Begin with cleanliness and relaxation. A warm shower beforehand can soothe your muscles and lower tension. Ensure your nails are trimmed short, wear a clean, medical-grade glove, and use a lubricant specifically designed for rectal use. Proper lubrication is crucial, as the rectum doesn't self-lubricate, and inappropriate products can cause irritation or infection. Step 2. Choose a comfortable position. Most older men find comfort either lying on their side with knees gently drawn towards the chest, or standing with one foot elevated on a stable surface while leaning slightly forward. Always choose what allows your body to relax most naturally. Step 3. Insert gently. With your gloved, lubricated finger, insert carefully about 1 to 2 inches into the rectum, aiming towards your belly button, where the prostate is located. Move slowly, pausing if you encounter any resistance, and focus on gentle expiration rather than forceful movement. Step 4. Locate your prostate. Feel for a smooth, rounded area similar in size and texture to the tip of your nose. If you can't locate it immediately, remain patient. Muscle tension or anatomy differences may initially hinder detection. Step 5. Massage gently and briefly. Upon locating the prostate, apply gentle circular motions or soft, side-to-side sweeps with very light pressure. Think of how gently you would touch a closed eyelid. Limit this massage to around 30 seconds, as excessive pressure or duration can cause soreness, bruising, or irritation. You can always revisit this technique in a few days if necessary. Step 6. Aftercare is important. Slowly withdraw your finger, dispose of the glove properly, and thoroughly wash your hands. It's common to feel an urge to urinate afterward, or even nothing at all. Both are entirely normal. Drink a glass of water, rest comfortably, and note your sensations and comfort level later that day. For beginners, performing this once weekly is sufficient. After a few sessions, assess how your body responds. If the massage proves helpful and your doctor approves, you can adjust frequency accordingly. Remember, this isn't about following a trend or seeking pleasure. It's about reclaiming comfort, ease, and confidence in a neglected yet vital aspect of your body's health. If you found this information helpful, please like this post, comment with your experiences or questions below, and don't forget to subscribe for more expert tips and practical guidance to keep your health at its best. Your support helps us reach more men and spread awareness about these important, yet rarely discussed, health topics. Of course, prostate massage isn't suitable for everyone. Safety, preparation, and awareness of your body's condition are absolutely crucial. So before we move forward, I want to emphasize clearly that prostate massage must be approached with caution, and in some cases, it could potentially worsen existing health issues. Let's discuss when you should pause, reconsider, and consult your doctor before proceeding further. Firstly, if you have symptoms of a prostate infection, known as prostatitis, such as pain in your lower pelvis, burning during urination, or fever, stop immediately and seek medical advice. Performing prostate massage under these conditions could push bacteria deeper into your prostate, causing severe inflammation, higher fever, and possibly hospitalization. Secondly, if you have or suspect prostate cancer, prostate massage should generally be avoided. Although current evidence doesn't conclusively indicate that massage worsens cancer, most urologists advise against it when cancer is present or suspected. This is because the prostate tissue might be fragile, and massage could interfere with diagnostic procedures or cause unnecessary bleeding. Thirdly, if you've recently undergone surgery or radiation therapy around your rectum or prostate, refrain from prostate massage. Healing tissues are delicate, and even gentle pressure could trigger bleeding or significantly delay your recovery. Additionally, conditions like severe hemorrhoids, bleeding disorders, unexplained chronic pelvic pain, recent pelvic trauma, or a compromised immune system should prompt you to avoid prostate massage or at least consult your doctor first. If you're unsure or hesitant about discussing this openly, bring it up gently at your next urology appointment. You don't need to explicitly mention prostate massage if it's uncomfortable. Instead, you might say, "Doc, I heard there's a technique that can help with urinary pressure and flow. Should I consider exploring it?" Rest assured, your doctor will understand exactly what you're referring to. Ultimately, prostate massage is a therapeutic tool, not a toy. Like any tool, when used incorrectly or without professional guidance, it can do more harm than good. If you found this information valuable, please remember to like this content, leave your thoughts or questions in the comments section, and subscribe for more helpful, expert guidance on men's health topics. Your support helps us continue providing essential health insights to those who need them. In the next part, I'll share real stories from men who've explored prostate massage, what worked, what didn't, and how it transformed their relationship with their bodies. I know how all this might sound. If you've stayed with me this far, you're probably thinking the same thing most men wonder at this point. Does this actually work for someone like me? Let me introduce you to three real men, each over 60, each with his unique experience, yet united by their openness to try something carefully, respectfully, and with proper guidance. George, 71. "I just wanted to sleep again." George was waking up 5 or 6 times a night, each time exhausted by endless trips to the bathroom. Medications made him dizzy, and surgery felt too risky. His urologist suggested something unconventional, gentle prostate massage once weekly. Within a month, George was sleeping almost straight through the night. He told me, "I didn't expect a miracle, but getting even one restful night felt like one." Luis, 66. "The pain had been part of my life for 12 years. Luis suffered from chronic, nagging pelvic discomfort. After traditional approaches ruled out infections or surgery, he felt trapped. Guided prostate massage coupled with pelvic relaxation techniques reduced his pain dramatically, from a 7 to a 3. After years, he could finally take walks without his heat pack. He shared, "It didn't solve everything, but it gave me momentum again." Marcus, 74. "I was afraid of intimacy. Minor leakage had caused Marcus to withdraw physically from his wife. Embarrassed and ashamed, he felt increasingly isolated. With medical clearance, prostate massage became part of his wellness plan, not about performance but reconnection. It enhanced his confidence and communication with his partner. As his wife said simply, 'He smiles again.' That's all I needed." Let's be clear, not everyone experiences such notable improvements immediately. Some men feel minimal changes or need more time to adapt. Many never even try due to stigma. Yet for those who approach prostate massage carefully, realistically, and safely, the rewards often extend beyond the physical. It's about regaining restful sleep, comfort, dignity, and emotional intimacy. In the next segment, let's openly address the elephant in the room, the emotional barriers men face about this topic, questions you might silently be asking yourself. Isn't this weird? Does this make me less of a man? What will my partner think? These are genuine emotional concerns, not medical ones, and they're completely valid. For generations, most men were taught the same unhealthy lesson. Don't talk about down there, don't ask questions, just silently endure it. But here's the empowering truth. Genuine strength isn't found in silence. It's found in acknowledging your body's needs and courageously caring for yourself, even when it feels unfamiliar. There is absolutely nothing shameful or emasculating about responsibly caring for your prostate, no more so than checking your blood pressure or managing cholesterol. Your prostate isn't political or embarrassing, it's biological. If something biological affects your life negatively, you deserve real, practical options to manage it effectively. Wondering what your partner might think? Try saying something gentle yet honest, like, I've learned about a safe technique that might help with the pressure and discomfort I've been experiencing. I'd like your support as I explore it. Would you be open to learning about it together? Most partners appreciate openness and vulnerability over perfection. They're looking for genuine connection, honesty, and the opportunity to support your health journey. No, prostate massage isn't weird. It's proactive, informed, and empowering. For men over 60, embracing curiosity about your health is not just smart, it's courageous, because staying silent keeps you stuck. Choosing openness, exploration, and self-care fosters genuine healing and progress. Now let's bring it all together. You've learned the science, method, and risks, but maybe you're still asking, how do I actually start? Here's a practical, straightforward plan designed specifically for older men by a urologist. No guesswork or pressure, just careful measured steps. Week 1, talk with your doctor. No full checkup required if you've had a recent one. Simply seek medical clearance. At your next appointment, ask clearly, would gentle prostate massage be safe given my history? Optional, PSA test, urine flow study, or pelvic ultrasound if recommended. Week 2, initial exploration. Choose one calm day without distractions. Follow the step-by-step guidance shared previously. Immediately afterward, write down your sensations: discomfort, pain, or relief. Any urination changes over the next 24 hours? Remember, you're not seeking instant results, but gentle self-awareness and subtle improvements. Week 3, repeat and track. If comfortable, repeat once more, noting changes in nighttime urination, pelvic tension, or overall ease. If you don't notice immediate improvements, remain patient. Many don't until after several sessions. Week 4, evaluate clearly. After 3 to 4 sessions, pause and reflect. Has anything improved, even slightly? Did anything worsen? If beneficial, consider an optional maintenance routine every 10 to 14 days, combined with pelvic relaxation exercises. Avoid sessions during illness or symptom flare-ups. Reassess regularly. This isn't a race. It's a thoughtful return to comfort, confidence, and control. You didn't explore this content casually. Something within you urged action, discomfort, curiosity, or perhaps the hope of reclaiming your sense of self. Here's the vital truth. You are not broken. You are not weak. You're never too old to reclaim strength, restful sleep, and intimacy. Men over 60 rarely hear this vital message. It's not only okay, but essential to ask questions, proactively care for your body, and choose genuine wellness over silent endurance. Whether you adopt prostate massage or simply gain deeper bodily awareness, you've already achieved something most men never do. You've paid attention, invested your time, and genuinely listened to your body. Your future self will thank you profoundly. If this guidance resonated with you and you're ready for renewed comfort, better sleep, and enhanced dignity in your life, comment below with one simple, powerful word: ready. Ready for restful sleep, open dialogue, and reclaimed vitality. And please, if you know someone, perhaps a brother, friend, or father, struggling silently as you once did, share this information. Your action today might help restore their confidence, comfort, and dignity. Lastly, don't forget to like this content if you found value, leave a thoughtful comment, and subscribe for more practical, expert-driven insights on men's health. Your engagement helps us reach and support more individuals just like you.